Okay, let's talk about a moment that is just packed with emotion. Taking a home pregnancy test. It's this little piece of plastic that holds a potentially life changing answer, right? And in that moment, there's so much hope, maybe some anxiety, and just a ton of questions. We're going to break down exactly how these things work, clear up all the confusion, so you can actually feel confident about the result you see.
And this is it, isn't it? This is the question. It doesn't matter if you've been planning and trying for months or if this is a complete and total surprise. Those few minutes you have to wait for the result, man, they can feel like an absolute eternity. So let's dive into what's actually happening inside that little test and, more importantly, inside your body to get you that clear answer you're looking for.
So, how in the world does this test know? I promise you, it's not magic, even though it kind of feels like it. It's actually some pretty brilliant science. You can think of the test as a detective, and it's on the hunt for one very specific clue, a secret messenger that your body only starts sending out when a pregnancy has officially begun.
And here it is. This is our secret messenger. Its official name is HCG, which stands for human chorionic gonadotropin. You can just call it the pregnancy hormone. Now, here's the key. Your body doesn't just make the stuff for fun. It's only produced after a fertilized egg travels down and successfully attaches, or implants, into the uterine wall. That's when the brand new placenta starts making HCG. So no implantation, no HCG. It's that simple.
This little timeline explains everything about why waiting to test is so important. So after fertilization happens, it can still take a good 6 to 12 days for that egg to implant and for HCG production to even start. And at first, the levels are teeny tiny, but then the race begins. The amount of HCG in your system starts to double roughly every 2 to 3 days. It's an incredible rate of increase. And it's this rapid rise that finally gets the hormone to a level where a test can pick it up in your urine, which is usually right around the time you'd expect your period.
All right, so that's the science lesson. Now let's get practical. Because, knowing how it works is great, but using it correctly is what actually gets you a reliable result. Let's think of these next few steps as your personal toolkit for getting a clear, accurate answer and avoiding all those common mistakes. Okay, these 4 steps right here, they are your best friends for getting an accurate result. First up, check the expiration date. It sounds so obvious, but an expired test is just not reliable. Second, and this is a big one, try to use your first morning urine. Why? Well, because you haven't been drinking anything all night, your urine is way more concentrated. That means the HCG is more concentrated too, making it much easier for the test to find. Third, you've got to read the instructions. Seriously, different brands have slightly different rules. And finally, number 4, set a timer on your phone. Reading the result too soon, or just as importantly, way too late, is probably the number 1 cause of confusion. This step is absolutely critical.
And this is exactly why timing is everything. Look, I know some tests on the shelf claim they can work days before your missed period, and they might, but the accuracy is so much lower. The risk of getting a false negative where the test says no, but you actually are pregnant, is just way higher. But if you can just hold on and wait until the day you expect your period, the accuracy for most tests shoots up to around 99%. Waiting just a few more days can make all the difference in the world.
Okay, the moment of truth. You've waited, you've done the test correctly, and now you're looking at the result. Let's talk about what you're actually seeing, especially when it's not a super clear yes or no. This is where things can get really confusing. So first off, you've basically got 2 choices at the pharmacy. You've got your traditional line tests. You'll always get one control line. That just tells you the test is working properly. If a second line shows up, that's your positive result. Then you have digital tests. These take all the guesswork out of it and just spell it out for you in plain English, pregnant or not pregnant. They're obviously a lot easier to read, but they do usually cost a little more. Yes, the faint line. Is there anything more maddening? You're squinting at it, holding it up to the light, turning it this way and that, asking anyone who will listen, do you see that, or am I just losing my mind? This is, without a doubt, the most common question people have. So let's figure out what it actually means.
Let's settle this once and for all, because there is a massive difference between a faint positive line and something called an evaporation line. A true faint positive will have color. It'll be pink or blue, just like the control line, and it will appear within the test's time limit. It's only faint because your HCG levels are still pretty low, but they're high enough to be detected. An evaporation line, on the other hand, is what can show up after the time limit is over. It's basically a colorless, grayish shadow that's left behind as the urine dries on the test strip. And that is exactly why setting that timer is non-negotiable. So here's the big takeaway. If you see a line, I don't care how faint it is, and it has color, and it showed up within that time window, the test has almost certainly detected the pregnancy hormone. A line is a line. It usually just means you've tested super early in the pregnancy, and that's it.
But what about when the result just doesn't add up? You feel pregnant, your period is late, but the test keeps saying no. Or in really rare situations, the opposite happens. Let's do a little troubleshooting for these confusing scenarios.
Getting a false negative is so frustrating, but there's usually a simple explanation. By far, the number one reason is just testing too early, before your HCG levels had a chance to really ramp up. Another really common one is diluted urine, which again is why that first morning sample is your best bet. And of course, simple user error, like not following the instructions or using an expired test, can mess things up. In very, very rare cases, some medical conditions could be a factor, which is why a follow-up with a doctor is always a good idea. Now, you might be wondering about the opposite scenario, a false positive. Can the test say you're pregnant when you're not? The most important thing to know here is that this is incredibly, incredibly rare. Remember, the test is specifically built to find HCG, and that hormone just isn't supposed to be in your body otherwise. So on the off chance a false positive does happen, it's usually because of one of a few very specific things. After a birth or a recent miscarriage, HCG can linger in your system for a few weeks. Also, some fertility treatments actually involve HCG injections, which would obviously cause a positive test. And finally, some extremely rare medical conditions like certain types of tumors can produce HCG. But for the vast majority of people, a positive test means a pregnancy has begun. So, you've gotten your result. Whether it was the answer you were hoping for or not, the question immediately changes from, am I pregnant, to, okay, what do I do now? So let's map out the clear next steps to get you from this first clue to a final, confirmed answer. Here is your game plan, clean and simple. If the test is positive, even if it's a faint positive, the very next thing you should do is call your doctor and make an appointment. They'll be the ones to officially confirm the pregnancy, probably with a blood test, and get you started on the path to prenatal care. Now, if the test is negative, but your period is still missing in action, don't freak out. Just wait a few more days, maybe up to a week, and test again. Give those HCG levels time to rise. If another week goes by and you're still getting negative results and still no period, then it's time to check in with a doctor to see what might be going on. So, if there's one thing to take away from all of this, it's that a home pregnancy test is an amazing first step. It is a powerful, powerful clue about what's happening inside your body. But it is not the final word. That final confirmed answer, that peace of mind, always comes from a healthcare professional who can give you the real guidance and care you need. And that really brings us to the end. The journey that leads you to take one of these tests is so personal and different for every single person. So no matter what that little stick says, it really is just the beginning of a new chapter. The result isn't an ending, it's just a signpost on the road to whatever your next great adventure is going to be.